everyone! Today we're diving into everything you need to know about acne. Whether you've been struggling with breakouts or are just curious, I've got you covered with the essentials. We'll be talking about what causes those pesky pimples, debunking some common acne myths, and sharing my top tips for getting clearer skin. I've definitely had my fair share of struggles with breakouts, so I totally get how frustrating and confidence-knocking it can be. But trust me, you're not alone, and there are things you can do to get your skin looking and feeling its best. So grab a cup of tea, get comfy, and let's get started. So, first things first, what exactly is acne? Acne is a skin condition that happens when your hair follicles, those tiny little pockets in your skin, get clogged with oil and dead skin cells. It's like a traffic jam happening beneath the surface. Our skin naturally produces oil, called sebum, which is actually a good thing. It keeps our skin moisturized and protected. But sometimes dead skin cells and excess oil can build up, creating a blockage in the follicle, and that's when the trouble starts. Bacteria love to hang out in these clogged pores, and when they multiply, it can lead to inflammation, redness, and those annoying bumps we know as pimples. Acne can show up in different ways too. You might get blackheads, which are open clogged pores that look black because of oxidation, or whiteheads, which are closed clogged pores that look like little white bumps. And then there are the more inflamed types of acne, like papules, pustules, nodules, and cysts. We'll talk more about those different types in a bit. Now, let's break down the different types of acne because knowing what you're dealing with can help you find the right treatments. As I mentioned, there are two main categories: non-inflammatory and inflammatory acne. Non-inflammatory acne is like the chill cousin. It includes blackheads and whiteheads, which are generally painless and don't cause a lot of redness or swelling. Inflammatory acne, on the other hand, is a bit more intense. It includes papules, which are small red bumps, pustules, which are similar to papules but have a white or yellow pus-filled center, nodules, which are larger painful bumps that are embedded deeper in the skin, and cysts, which are the most severe type and are filled with pus, often painful, and can leave scars. It's important to note that you can have different types of acne at the same time. It's not like you just get one or the other. Your skin can be a bit of a mixed bag, which is totally normal. So, what causes all this acne mayhem? Well, it's not just one thing, unfortunately. It's usually a combination of factors. Hormones are a huge culprit, especially during puberty. That's why teenagers are particularly prone to breakouts. Hormonal fluctuations can increase oil production, making breakouts more likely. But it's not just teenagers who deal with hormonal acne. Adults can experience it too, often related to their menstrual cycle, pregnancy, or even stress. Speaking of stress, it can definitely wreak havoc on your skin. When you're stressed, your body produces cortisol, a hormone that can trigger inflammation and increase oil production. Genetics also play a role. If your parents had acne, you're more likely to experience it too. Thanks, Mum and Dad. And lastly, your diet and skincare routine can also contribute to breakouts. We'll dive deeper into those later. Chapter 4. Let's bust some common acne myths, shall we? Because there's a lot of misinformation out there that can actually make your acne worse. Myth number 1, greasy food causes acne. Now, while a healthy diet is always a good idea, there's no direct link between greasy food and breakouts, so no need to swear off pizza entirely. Myth number 2, chocolate gives you pimples. Again, not entirely true. Some studies suggest that dairy might be a trigger for some people, but chocolate itself isn't the enemy. Myth number 3, you need to scrub your face to get rid of acne. This is a big no-no. Scrubbing your skin too harshly can irritate it, making inflammation worse and potentially leading to more breakouts. And lastly, myth number 4, only teenagers get acne. As we talked about earlier, acne can affect people of all ages, even babies. So don't let anyone tell you you're too old to have acne. Chapter 5. Acne treatment tips. Now for the part you've all been waiting for, how to actually manage and treat acne. The first and most important step is to establish a gentle skincare routine. Start with a gentle cleanser that's specifically formulated for acne-prone skin. Look for ingredients like salicylic acid or benzoyl peroxide, which can help unclog pores and kill bacteria. After cleansing, apply a treatment product that contains those same acne-fighting ingredients. You can use a spot treatment for individual pimples or a serum or moisturizer that targets your whole face. And don't forget to moisturize. Even oily skin needs hydration. Just choose a lightweight, oil-free moisturizer that won't clog your pores. It's important to be patient and consistent with your skincare routine. It can take a few weeks or even months to see significant results. Chapter 6. Lifestyle changes to help acne. Alongside a good skincare routine, there are some lifestyle changes you can make to help improve your skin from the inside out. First and foremost, drink plenty of water. Staying hydrated is crucial for overall health, including your skin's health. Managing stress is also key. Try incorporating stress-reducing activities into your routine, like yoga, meditation, or spending time in nature. Eating a balanced diet rich in fruits, vegetables, and healthy fats can also make a difference. Foods high in omega-3 fatty acids, like salmon and walnuts, are particularly beneficial for reducing inflammation. And last but not least, make sure you're getting enough sleep. When you don't get enough shut-eye, your body produces more cortisol, that pesky stress hormone we talked about earlier, which can trigger breakouts. Chapter 7. When to see a dermatologist. If you've tried over-the-counter treatments and lifestyle changes, and you're still struggling with acne, it might be time to see a dermatologist. Dermatologists are skin experts who can help determine the underlying causes of your acne and recommend personalized treatment plans. They can prescribe stronger topical or oral medications, like retinoids or antibiotics if needed. And they can also perform in-office procedures, like chemical peels or extractions, to help clear your skin. Don't be afraid to reach out for professional help if you need it. Acne is a medical condition, and there's no shame in seeking treatment. Outro, that's a wrap on acne. That's all for today. I hope you found this video helpful and feel a bit more empowered to tackle your acne head-on. Remember, you're not alone in this journey. Acne is incredibly common, and finding the right routine for your skin can take time. Be patient with yourself and your skin, and don't get discouraged if you don't see results overnight. Consistency is key, and if you're feeling overwhelmed, don't hesitate to reach out to a dermatologist for guidance. Make sure to subscribe for more skincare tips, and I'll see you next time.